Our system is broken. I think we all know that. We do not have a healthcare system. We have a sick care system. You get sick, you go to the doctor. It should actually be the other way around. You should be going to doctors when you're healthy to keep you healthy. And I thank the previous two speakers because they actually proved my point. Neither of them spoke about the mouth, did they? And yet what we know is that the single most common cause of inflammation, which they did speak about as a cause of chronic disease, the single most common cause of inflammation is gum disease. It's found in the mouth. When did you go to a doctor, other than a dentist, and that doctor asked you, when were you last at the dentist? Doesn't happen. Why? It should. I've written books. I try to educate physicians and other health professionals about trying to understand why the mouth is important. Here's one other thing that the previous speakers did not speak about, and that I speak to every one of my patients about. Now, I'm a dentist, but I speak to them about breathing and breathing during sleep. Sleep was mentioned, but breathing wasn't mentioned. Breathing's a big deal. It sets up your metabolism. It affects your mouth tremendously and contributes to inflammation. So, as a dentist, I want to cure the causes rather than treat the symptoms. That's what all doctors should be doing. So, I'm on a mission, and that's why I'm here. I want you to demand of your healthcare professionals that they get at the cause of the problem before giving you any kind of treatment. I don't care what the treatment is. What's the cause? So I cured myself of psoriasis. 5 years ago I had outbreaks of psoriasis. I went to the dermatologist, he took a biopsy. Yep, you have psoriasis. Here's some creams. I wasn't so happy about that. Not that the creams didn't work, they stopped the itching, but I want to know why. Why did I get this? All the diseases that we're talked about before, chronic diseases, starting probably from some type of chronic inflammation, whether it's leaky gut, whether or not it's sugar, whatever the issue is, chronic inflammation. The biggest category of disease today, autoimmune disease. Our inflammatory systems are on hyperdrive. Back to my psoriasis. I started investigating what the potential causes of it were. And it took me to nutritionists, and it took me to holistic practitioners. And it was ultimately diet. Went on an anti-inflammatory diet, boom. It took a little while. It took about 5 to 6 months. Psoriasis is gone. Zero. Not it. Inflammation, in my case, probably leaky gut, probably from sugar and gluten. Actually, I'm off all wheat products, actually. I'm off all grains. Probably contributed to that. But my point, and what I really want you to take away from this is, don't let your doctors treat symptoms before they try to give you an idea of what the causes are. Dentists are great at doing preventive dentistry. Most of you have probably been to a dentist fairly recently. That's great. Have you ever had your bacteria tested? You don't even know that you can do that. I test all my patients' bacteria. Why? Because that's the cause of gum problems. Not even if you have gum problems. It'll tell you that you might get gum I ask my patients about their breathing. Nasal breathing is how we're built. Do you mouth breathe at night? Is that a problem? Yes, it is. Now, again, I'm a dentist. I can't necessarily treat your breathing issues, but I can point you in the right direction so that you can start dealing with the cause of the problem instead of having to deal with the symptom. What's one of the symptoms of a breathing problem? Asthma. I had asthma. I don't have asthma anymore. Breathing is a big deal. We're meant to breathe through our nose. What does it do? It filters. It warms. It humidifies. It's the prime directive. You can live without eating for days. You can't live without breathing for 10 minutes. Your body will find any way possible to make you breathe. And sometimes we adapt in ways that are not healthy for us. Our friend the chiropractor sees many patients that I'm sure have back problems and neck problems because they're not breathing correctly. What else does nasal breathing do? It allows your sinuses, and your sinuses are not this vestigial organ. It does have a very useful part in your health. They produce nitric oxide, not the laughing gas that we use, not nitrous oxide, nitric oxide, produced in our paranasal sinuses. Nitric oxide is a very powerful blood dilator. It helps us assimilate oxygen, and it helps us get rid of carbon dioxide in our lungs as we breathe. It's also, by the way, one of the things that most men suffer from when it comes to erectile dysfunction, lack of nitric oxide. So get your hubbies to breathe through their noses. So I love the previous speaker talking about bio-individuality. And in fact, I brand the kind of dentistry that I practice as bio-rational. Everyone is different. It's a puzzle. So when you spoke about the diet that you're on and not getting necessarily the results that you want, we all have so many different things going on, but everyone's looking for the formula. And I'm here to tell you, there is no formula. Everyone is different, and trying to figure out what your difference is, that's your challenge. And finding health practitioners that can help you on that quest, that's your challenge as well. Any questions? Sure.
How about opium?
What do I think of opium? I can't answer that question for you. Again, you're asking me for something that is an individual issue. You need to go to somebody who can look at the big picture and say whether or not it's right for you. I can't tell you. I can tell you, what I can tell you is we're also meant to chew things. So, juicing is not a good thing. Sorry. We're meant to chew. If we don't chew, our muscles don't contract the glands that secrete saliva. Saliva is your first step in digestion, and it helps break things down properly. So, I'm not a big juicing fan. And it's highly acidic, usually. So, presents other issues like reflux and other problems.
When you speak of breathing, I'm wondering the causes that you know of from sleep apnea. Physical, is it breathing, or?
So again, that's a great question. The cause of sleep apnea, everybody hears about sleep apnea now because that's what caused all the train accidents and stuff like that. Sleep apnea is a big deal. The cause is variable. You have to understand that there's something called central sleep apnea, which is a neurologic problem. Then there are mechanical issues. If you look at our faces, anthropologically, our faces have become flattened. It's not how we were originally meant to be. We were meant to have our faces a little bit more forward. And that's because it gives more room for the tongue. Our tongues are being pushed back. When your tongue is being pushed back, it impacts your airway in the back. Again, something that I speak to all our patients about, and we analyze that. It could be a mechanical issue, it could be a functional issue. You have to see what's right for you.
Please describe this
So rather than describe it, I don't know the doctor's name, but it's called the D-Flame diet. D-E-F-L-A-M, D-Flame diet. It's what I'm on. Again, it worked for me. Whether or not that's right for you, I do think that if you find a really good nutritionist or counselor that can figure out what's right for you, I think a part of that puzzle is what's going on in your mouth. You have to think about what's happening in your mouth. Do you know that if you keep your teeth, you will live on average 6.5 years longer than people who don't? It's how we're built. We're built to chew our food. Yeah.
When you did that being the mouth breather when you sleep, like what can you do for that?
So the question was, what can you do if you're a mouth breather when you sleep? So first of all, it's figuring out why. Do you have some type of physical nasal blockage that's preventing you from breathing through your nose? I mean, most of us, if we get a cold, some kind of a respiratory infection, we can breathe through our mouths. The other thing is, so you have to find out what the cause is. There are exercises. So I have a bunch of grandchildren, and it seems like they always have some kind of cold or upper respiratory infection. And my son and daughter-in-law always tell us that the kids are snoring and grinding their teeth and doing all kinds of things at night. Kids like that will naturally breathe through their mouths. And even after they outgrow their upper respiratory problems, they've gotten used to breathing through their mouths. So sometimes breathing through your mouth is habitual, and you can actually learn how to breathe through your nose and not through your mouth. There's a great book called The Oxygen Advantage. Patrick McGowan. And he gives exercises about how to do that. But definitely breathing through your nose is the way we're supposed to breathe. Breathing through your nose is healthy. Yeah, there was another question.
Myself, yeah. Can you speak to the issue that we have fluoride in our water, fluoride in most of the toothpaste that people probably buy here, and your view, which sitting here for 10 minutes, I get the sense you're a holistic dentist, so I'd love you to speak a little bit to the audience about that.
I really hate the word holistic.
Okay.
And I don't consider myself holistic.
Okay.
That's why I coined the phrase biorational, because I think there needs to be a biologic and rational basis to everything that I do and recommend. And fluoride's a bit exactly that. It almost encapsulates that entire thing. Is fluoride good? Maybe. Is fluoride bad? Maybe. I don't know if it's good or bad for you. It's why I'm against fluoride in the water. I understand the benefits of it. I grew up with fluoride in the water, and I benefited from that because I have no chemicals. But I do know that fluoride in the water does absolutely nothing for anybody in this room, because it's only good for kids. So what's the government saying? The government's saying we don't trust the parents to do what's right for the kids when it comes to preventive dentistry. And I do think fluoride for kids that don't have chronic illnesses. Again, you have to look at their toxic burden. Look at the big picture. If you have somebody who's feeding their kid naturally and doing all the right things, maybe that child will tolerate fluoride just fine in their vitamins. But to give everybody fluoride, I give lots of my elderly patients fluoride. Why? Because I know if I don't, they're going to succumb to decay. Now, I have to tell you that I test their bacteria, so I know whether or not they're going to be prone to decay beforehand. So I'm looking at the underlying causes, and I'm trying to tailor my treatment for the particular issues that I see they have or they will have. Fluoride is a thing not to treat something now, it's to treat something down the road. Depends what your other risk factors are. I hope that makes sense. So I'm anti-fluoridation in water, but I am pro-fluoride as a treatment modality depending on what your risk level is. Sure.
Thinking about what you mentioned earlier, I've had extensive periodontal work done, and I also had injections of an antibiotic, which seems to have really helped my mouth tremendously. But since then, I'm noticing less knee pain than I used to have. But I'm a mouth,
You
breather.
proved my point, yeah.
I'm a mouth breather. Now, you mentioned a book, and I didn't.
The Oxygen Advantage by Patrick McKeown. McKeown. So he just proved the point. But so how do we get the bacteria in our mouth? We get it from our parents. We come out sterile. We get the bacteria from our parents and those we love and exchange fluids with. That's how we get the. We used to think gum disease was inherited. It's not inherited. What's inherited is the bacteria we get from our parents. The reaction you have to those bacteria, that inflammatory or not reaction, that's inherited, that's partially genetically mediated. But what you did was you had somebody treat the symptoms. Those bacteria, unfortunately, are still in your mouth. And they will come back if they're not meticulously taken care of. So what we do is we want to test the bacteria first. And then arrest them. That's the injection that you had. Perfectly fine. But there may be other things. I don't like using drugs if I can avoid it. If it's a bacteria problem, I might be able to get rid of it in another way. And there are plenty of different ways of doing that.
Hi. A few minutes ago, you gave us a term to describe the kind of dentistry that you do. I'm not familiar with that term. You probably talked about it earlier.
So it's my term. I sort of invented it. It's called biorational. And I wrote a book about it. It's a way of looking at dentistry in a more holistic, with a W way, and making sure that things make sense. And that's why I'm here. I'm here to help you make sense of the things that you're being told and that are being done to you. It has to make sense.
And what was the other term you used? Altruistic? Was that the other word? Some dentists are
No?
altruistic. You used another term also that I wasn't.
I mean, I'll take altruistic if you want.
I don't have a medical background, so I'm not familiar with all of your
No, it's
vocabulary.
Bottom line, I'm a dentist. I make my money doing cosmetic things, doing implants, and doing other treatment. I actually don't make that much money doing diagnostics, yet I spend most of my time doing diagnostics. I want to uncover causes. The problem with our system, and the reason it's broken, is that insurers do not cover finding causes. They cover the treatments and dealing with symptoms. They'll cover the drug that you're going to get, but they're not going to cover the quest that we have to find out what the problem really is. That's what's broken about the system. But you're doing the smart thing, you're educating yourselves. You should be congratulated. Give yourselves a hand. Thank you.